All right, so another part of chapter 15 that I want you to focus on are a couple different infectious agents. I've pulled just a handful out of the chapter that I'd like you to kind of be aware of and be aware of how they're transmitted and a little bit more detail about the particular either bacteria or virus, okay? We'll start with Streptococcus pyogenes. All right, that strep pyogenes, that's the bacteria that causes strep throat. All right, it's going to be a gram-positive bacteria. And in terms of that, strep throat typically is going to enter via the oral cavity or the respiratory system. All right, but in terms of that, if strep pyogenes gets into and enters via the skin, it actually causes necrotizing fasciitis. So in terms of bacteria, the portal of entry can be really important in as far as what type of disease is caused by the particular bacteria. Okay, this is really more true for bacteria than it is for viruses. But strep pyogenes, if it gets in the throat, it's going to cause strep throat. If it enters via the skin, via a cut or a wound, then you're talking about the necrotizing fasciitis, okay? Another gram-positive bacteria that you will probably come across in your experience as a healthcare provider is going to be Staphylococcus aureus, okay? This is another gram-positive bacteria. And in terms of Staph aureus, the drug-resistant form of that is MRSA, all right? And in terms of Staph aureus, all right, that MRSA stands for methicillin-resistant Staph aureus. MRSA is resistant to just about all antibiotics we have, all right? So that gets really nasty. This is again going to be a gram-positive bacteria. And in terms of Staph aureus, typically it's associated, its portal of entry is via the skin. And in terms of that, it can cause minor skin infections if it's not one of the MRSA type strains. It can also lead to much more severe infections and can also lead to sepsis in some cases, okay? So Staph aureus, another gram-positive bacteria. I've got a couple gram-negative bacterias. Chlamydia, Trachomitis, okay? Chlamydia, now this is going to be a gram-negative bacteria. And in terms of chlamydia, this is one of the bacteria that can lead to infertility, not only in women, although it's more common in women, but can also lead to infertility with men also, okay? Because it can cause an inflammation of the prostate or the epididymis in men. With women, this is one of two bacteria that typically are associated with PID, or pelvic inflammatory disease. The other one that's associated with PID, we'll put up here, it's my other one for a gram-negative, is going to be Neisseria. Oop. That needs to be lowercase. All right. It's going to be Neisseria. gonorrhea. Oops. Here I am trying to make that gram-positive. It's gram-negative. Okay? Now, in terms of that, these are going to be the two most common bacteria associated with pelvic inflammatory disease for women. And the reason for that is more often than not with women, these two bacteria can be kind of a silent infection, meaning the woman is infected with the bacteria, but she doesn't have overt symptoms of having a bacterial infection. Okay? And what happens, those bacteria continue to hang out in the reproductive tract. They'll reproduce, they can multiply, can cause abscesses, and in terms of that, interfere with fertility in that if that particular abscess is blocking fallopian tubes, sperm isn't going to get to the egg to fertilize it. Okay? So both of these cause some degree of infertility in both men and women, and can be found in both men and women. Okay? Some other bacteria that I want you to kind of be aware of the name, and I need to look at this one because I'm not sure I'm spelling always with this one. It's Treponema pallidum. Okay? Some of these others, the name of the disease kind of went along with the bacterial name. This one doesn't. Treponema pallidum causes syphilis. Did I spell that right? No, that's an I. All right. And in terms of this one now is going to be a spirochete or spirillum as far as shape of bacteria, okay? And in terms of syphilis, what's kind of unique about syphilis is that this particular bacteria can cross the placenta, all right? So in terms of that, when women are pregnant, they will be tested for whether or not they've got syphilis because the Treponema pallidum can cause birth defects and can cause miscarriage, cause all kinds of trouble for a pregnant woman, okay? In addition, mom can pass then that sexually transmitted disease onto the child, okay, because it has the ability to cross the placenta. So in terms of portals of entry, this is one I didn't focus on in the last video, but the placenta is another way that bacteria or viruses can gain entry to an organism. In this case, the placenta is always going to be a mom to child type of transmission. Mom is infected either with something like HIV or syphilis that crosses the placenta and infects the developing child. Okay? But Treponema pallidum is a bacteria associated with syphilis. All right? We talked a little bit in the previous videos about human papillomavirus or HPV. Okay? HPV is going to be a sexually transmitted disease. In the case of the sexually transmitted disease, 6 and 11 are the viral types that cause the genital warts. Okay? HPV 16 and 18 are our cancer-causing types of HPV. Okay? Another type of virus that I want you to be a little bit familiar with is going to be the herpes simplex virus. All right, easy to kind of get these two confused, HPV versus HSV, okay? Cause very different things. Herpes simplex virus, we've got two types. type 1, if you've ever had a cold sore or a fever blister, that was from a herpes simplex virus type 1 infection. Almost all of us have had an herpes simplex virus type 1 infection, okay? And in terms of that, that's very common in the population, all right? Herpes simplex virus 2 is going to be the sexually transmitted virus. And in terms of that, again, it causes the cold sore-like blisters that you see similar to HSV-1. They're a little different in intensity, and in terms of that, typically herpes simplex virus 2 is associated with genital lesions. Herpes simplex virus 1 is associated with the oral cavity, although you can have either type in either place, okay? So you can have herpes simplex virus 2 lesions that occur around the oral cavity. You can have herpes simplex 1 virus outbreaks on the genitals. So in terms of that, really it's epithelial cells that particular virus is going to infect. Difference as far as that goes is location, all right? Hopefully that makes sense. I've got a couple more I want to talk to you about, but I'm going to do that in another video. So we'll call this one part 1. If you have any questions, please let me know.